Hi, Jessica. How you doing?
I am fantastic. How are you, Amy?
Good. I'm glad to see you, and I'm admiring all the artwork on the back of your wall. That's much better to look at than some of the backgrounds of just plastic that I'm seeing these days. I'm thrilled to have this time to just kind of chat with you about the relationship that the foundation has built, gosh, over now many years with Ultragenyx, and just learn a little bit more about you and
Sure.
share some insights. So to get us started, do you want to just kind of introduce yourself and tell us about your role at Ultragenyx and what drew you to it?
Okay, so thank you. I'm really happy to be here today. My name is Jessica Riviere, and I'm the Vice President of Global Patient Advocacy and Patient Engagement. I work for Ultragenyx. We are a rare and ultra rare disease company that specializes in genetic rare diseases.
And what made you get into patient advocacy work?
I really came to patient advocacy work from a kind of a political angle. I had worked for a trade association in the late 80s and early 90s and spent a lot of time working at that time at the height of the HIV crisis around CDC recommended precautions for healthcare workers. I then went and got a master's degree and worked for Senator Kennedy and I was a health legislative aide at the time, and it was the Clinton healthcare reform, which seems like eons ago, but worked with a lot of third-party groups with all different interests, from the hospital associations to, rare disease groups, American Cancer Society, a whole host of people that had a very particular perspective. And I loved that engagement. I loved understanding what their issues were and how we could partner together on a legislative front to really drive change. I then took an 11-year hiatus and raised two children. And I really joined the industry by happenstance, to be honest with you. And I came to Ultragenyx, many years here I am. I feel like I'd finally come home, in that I work for a company and work with colleagues who have a level of commitment and authenticity that I think is kind of unparalleled. So for me, I've worked at a lot of companies. I've had great experience, great exposure, worked with really smart people, but Ultragenyx is a special place.
Wow. I love when I hear people's stories because they're never linear.
No.
They're never linear. And even my story about how I ended up at the foundation, which I will not share right now, is completely by happenstance. So tell me a little bit about, what are your thoughts now that you're at Ultragenyx and you're in the rare and ultra rare community? Any reflections about what that feels like, or insights that are similar or different from the other disease communities you worked in?
I think that I would say that the level of kind of commitment and determination is probably most similar to HIV and cancer. I kind of hearken it back to the days when there were very few solutions. There wasn't a lot of public information. And I think in many ways, advocacy today is where it is because of a really long historical precedence with the HIV community, really is the trailblazers. And the oncology space really a close second. And I think in rare disease, the reality is there's 7,000 rare diseases. There's probably more that we don't even know about. But of those that have been characterized, and I say that very loosely, is that you see families being faced with long diagnostic odysseys, and they find out finally, after many, many years, oftentimes. I have a friend, it took 19 years to find out what the rare disease her daughter was living with. And there's 14 people in the world that have it. So I think that level of determination, increasing sophistication, when we think about the intensity in which drives someone to really want to know everything they can know to make a difference, not only for potentially their child, but for the next family who has a child with a similar diagnosis. So for me, that is what is so inspiring. And there are so many incredible examples.
It's really all about how we can all leverage our strengths and work in partnership to get that better tomorrow. And one of the ways we try to do that here at the foundation is through our corporate advisory board, really because our board of directors feels it's so vital to have a forum where we are actively engaging those of you that are in industry that are bringing these impactful innovations forward. And we want to make sure that we're understanding where you're coming from, and we can share where the patients as well as the clinicians are coming from. Obviously, Ultragenyx has an incredible brand reputation amongst advocates, really doing the right thing. And you're invited to be part of many corporate boards. Can you tell me a little bit about why you all continue to accept our invitation and join our CAB?
I think a variety of reasons. The first and foremost is really having the diversity of thought and experience. So oftentimes, I think you have organizations that focus on one particular disease, and there's certainly tremendous value, and we partner with those organizations. But when you then take it to the next level, and in the neurological space, many of the rare diseases that we work in have a neurological component to it. And are there similarities? Are there things that we can learn across those diseases? Not only just the ones that we're studying, but peer companies are looking at, that we can come up with solutions and advance our understanding, for the broader good. So it's not just what are we doing in CDKL5 or creatine, transport deficiency disorder at Ultragenyx, but what are some of our peers doing that we hadn't thought about? What are some of those best practices? And having an organization like CNF that's looking at it at an even higher level and has the view of the top of the landscape to see where those potential synergies are, where those potential collaborations are, see where those, kind of signals are. What are the trends? What are the challenges? What are the barriers? And I think, it's also the integration of both patient perspectives and HCP perspectives, quite frankly, because that's a fairly unusual model. Most organizations either focus on what physicians think, or they focus on what patients and caregivers think and experience. And ne'er do the two ever meet, honestly. And they often have very different perspectives about what these diseases are, what it's like to live with one of these diseases. And so that also provides such a richness that's quite frankly kind of hard to find.
Thank you. I love that you said that, because I think that's one of our aims, is to put forth conversations and content that actually shows the commonality between caregivers and healthcare providers. Not saying that one experience is more valuable than the other, but if we can find those places of convergence, that's usually where some solutions can be generated for that better tomorrow for the child. We've got to find that we're on the same page. And there's a tendency, because there's such need and there's such urgent need, to finger point and kind of say, hey, it's your fault, or you're not prepared, and that you can understand that again from a human perspective and give grace, but that's not going to cultivate change. And I really think that's one of the things I really actually enjoy about our board of directors, is that it's multidisciplinary. You can see these conversations. You're about to get our findings from our national needs assessment from both providers and families. And when our board of directors was talking about it, it was fascinating to see their different opinions, but how they were making meaning of it and then how they were connecting. So I'm glad that you all see that value in our CAB. And for us, you as industry bring a totally different perspective that is different, but also the same to that conversation. It's kind of that three-legged stool that we find so valuable in our programming.
Absolutely.
So Ultragenyx has also been, when I think about longstanding corporate advisory board members, I usually can think, okay, that corporate advisory board member, they have gotten really involved in X initiative. That has been their bread and butter. Ultragenyx has been one that actually usually hops on very quick when we launch a new initiative, saying, hey, here's a new signal, here's a new need, and you get involved in it and you kind of help us get it off, and then you watch for the next signal to come. So it's interesting that you kind of already framed that about y'all. So you've been involved in a lot of initiatives in the last couple of years. Do you have a favorite that you kind of want to talk about?
I think the transitions program is probably the hallmark for us. I think it was something that, quite frankly, we hadn't even really thought about. You tend to think about the needs of children living with these neurological conditions and what does that mean for their caregiver. But how does that progression, what does that look like as someone, ages? And the needs of someone who are 15 are going to be very different than the someone who's 5 years old. What does that mean when you're 25? What does that mean when you're 35? And I think that was a good aha for us. And it's been interesting because it's not only relevant to the diseases that have a neurological component, we've actually incorporated, your transitions program into 2 other rare diseases that have no neurological component that we know of, XLH, as well as LCFAOD. One is a metabolic condition, the other is a bone disease. And that's the beauty of partnering and understanding things that are relevant regardless of what disease it is. There may be some nuance that we changed for those 2 different diseases about the transitions program, but it really has been such a rich experience for us. And then also obviously for the communities that we work with, because many also hadn't thought about that either. Because oftentimes the most active people in some of the advocacy groups are those that feel like they're in the eye of the storm right then and there.
Really?
Their families, they have young children, and they're looking for a community. And we often forget someone who's 25, someone who's 35. And a lot of the programming focuses on the support for those families, but not for adults living with some of these conditions, not acknowledging that there are transitions as you age and you are continuing to live with one of these conditions. So that's been a really important learning for us.
I have appreciated, and our whole organization has appreciated how you've understood that if we take good care of these children and they become young adults, it does not matter what diagnosis they're living with, even if they're of typical health, they are going to transition. 18 million Americans transition every year, whether they have a special healthcare need or not. But those that do need a lot more help. They need a lot more coordination, need a lot more support. And you all have understood that and then invested in that and then have brought it, like you said, over to other disease states that aren't communities that we touch. And it's really about walking that talk, like you get it. And then we've watched how you've really helped bring it over. And we have actually another CAB partner who watched you all do that and emulated it in other rare disease spaces. So
that's good to hear.
Thank you. Thank you for your leadership on that. I want to be a good steward of your time. I know we're running over. Is there anything else that you want to talk about or you want to share before we?
I guess what I would say is, as I said earlier, there are a lot of disease-specific organizations. But I would really encourage colleagues like myself in industry to look at some of these umbrella organizations, because there is a lot of learnings that you will give you a different perspective when you're actually working with a specific disease, that will give you a sense that you hadn't had a sense before. And it also allows you to go back to that organization and say, hey, have you thought about X? Your organization is built around this one specific age demographic. What does that mean for somebody living with osteogenesis imperfecta when they're 45?
Mm-hmm.
And so it's not only helpful for us as an organization at Ultragenyx, but really has been some rich learnings that we've been able to share with many of our partners. So it's been a great collaboration.
And vice versa. Absolutely, it's been nothing but positive. And just like you were saying, the cures and the treatments don't come overnight. Neither do partnerships. They're long-term investments. And so we just really, at the Child Neurology Foundation, really appreciate Ultragenyx for really the true partnership that we've built.
Well, thank you. I appreciate it.
Thank you. I've really enjoyed this.
Yeah, it was great.
We'll be seeing you.